My name is Shay Glover, and I'm from the Marshall County Health Department in Benton, Kentucky.
My name is Taylor Carter. I am the Academy of Sciences librarian here in the great state of Kansas.
My name is Norm Hess. I'm the Executive Director of the Michigan Association for Local Public Health.
Lincoln Trail District Health Department. My name is Elizabeth Pointer.
Sure, my name's Dana Nichols. I'm the Executive Director of the Kentucky Health Departments Association.
Jackie Ward. I'm from Maricopa County Department of Public Health, located in Phoenix, Arizona.
Dennis Creasel. I'm the Executive Director for the Kansas Association of Local Health Departments.
The problem is collecting local public health data can be really challenging, and also when it comes to making surveys, it can take a lot of time to make those surveys.
Like, someone else probably has these measurements in existence and I can't access them. And you're stuck in this hamster wheel and you're not able to get out.
Having to recreate that would be very cumbersome and very time consuming. And since we are doing more with less, anything that we can do to help in those efforts is important.
The grassroots effort that this started with was such a great vision, and the fact that it's grown so much is such a huge accomplishment for this group, because everything at the national level, the state level became so siloed.
So I first heard about AOS at SHO meetings.
And so I had heard about the Academy of Science project as an effort that really tied to a lot of surveying and the ability to collect data and the idea of standardization. So we started to have discussions and explore this concept because we've been using a disparate set of systems across the state. And we have a lot of people that are not experts in data collection and that sort of qualitative assessment. So we thought it would be worth pursuing.
And our Kentucky Health Department Association, they were in full support of the Academy of Science movement.
Was able to work with our leadership to recruit the appropriate people here in Kentucky to lead the effort, and grown each and every month since we started, I believe.
I was totally on board because I believe in the values, I believe in the mission.
It just sounded like a great idea to me. One of the things as an association that we always try to do is to find ways that our local public health staff can work more effectively and efficiently. The Academy of Science has helped us to find ways to reduce duplication on the part of our data collectors throughout the state as they look to collect data that is very similar to other health departments, but may not have access to those measurement tools.
Gave us the opportunity to really kind of standardize this data that we're collecting across the state. If everyone was going to be doing a community health assessment, we thought we should be asking the same questions in that process so that we could then use the data.
Full support of getting everyone on board, and then also just growing this association, and then making sure that those connections are happening at different state levels too. I know Dana has been in full support of trying to get other states involved as well.
We're going to have to be able to aggregate our local public health data. It was not a hard sell for our state, for our local health department directors to get on board. The project spoke for itself. So I didn't have to do a lot of talking anybody into anything. People were quick to offer up their staff, like Elizabeth Pointer, who is our lead here in Kentucky. She works at a local health department. people were quick to offer up their staff to be part of it and to help out. Really, it's just been getting the right people to the table, and that's how we've kind of gotten rolling here.
And so AOS is one of those ideas because of the benchmarking that's available if everyone uses the same sort of survey. And so one of the nice things that we really liked about the AOS model was the idea that there would be this library, a library of templates, a library of surveys. And if you wanted to make modifications, you could, but if you didn't, you not only would have a ready-to-go, already vetted device that you could use to do some sort of data gathering, but you could benchmark back to what other health departments, be they in the state or we're using a national tool from the National Library across the nation, so you have apples to apples comparisons.
So before the Academy of Science we saw a lot of duplication. We saw many circumstances where our data collectors in local public health departments were creating very similar tools, but using different language and having to recreate every time someone left the health department. And the person coming into the position didn't know where to find those things. So one of the great advantages has been that now folks are directed toward the shared library, and they know where to find items for various topics.
Local Health Department Academy of Science movement needs to happen. And there's a couple of different components to that. So the first component is to save staff time. The most important part of this is to use it to drive action. Collaborative. We're going to create these measurements together, pilot them together, figure out what data we can obtain from them together.
First of all, to thank the state of Kentucky, I just want to thank you for the support that you give local health departments, and that appreciation cannot be expressed enough. And to the CDC, thank you for the support that you've given AOS through grants and through staffing support, and for believing in the mission that we can create this standardization to help our communities and help the people that we need to help.